Hi guys, and welcome back to the Tried It podcast, where we'll be discussing all things from millennial struggles to relationships and love and everything in between. I'm Kadisha.
I'm Jade.
And I'm Maya. We've got a very special guest with us today.
Hi, my name is Cheyenne and I am a fully qualified registered nurse and I am the founder of Let's Talk Gynae.
Ooh.
Let's Talk Gynae has got a different meaning to us as well, because we all went to Let's Talk Gynae's second sip and paint on Friday. Why do you know that?
I didn't realise we were doing this already so soon.
I just want to show everyone.
Okay.
You've got it. And if you aren't seeing what we're holding up right now, it's because you aren't on the YouTube channel, so you have to go subscribe.
Yeah.
So, can you talk to us a little bit about why you started Let's Talk Gynae?
So I started Let's Talk Gynae to basically turn my pain into passion. And when I mean my pain, I mean at the age of 17, so now 23, I was diagnosed with two conditions, which is endometriosis and also polycystic ovarian syndrome. I was also told by my GP when I went to have like ultrasounds done, MRI scans, that I had a retroverted uterus as well.
What does that mean?
So my uterus is tilted towards my rectum, so it's tilted backwards. So it's just tipped instead of forward, which is the normal position that
It's supposed to be forwards, not just straight.
Not just straight. It's just tipped a little bit forwards. So I can't use tampons basically because it hurts. Like, basically.
Magic cups flying from the air.
So that's what a retroverted uterus is.
Is there anything else that you can't do apart from not wear tampons?
So the only thing is like with sexual intercourse as well, that can be quite difficult. Not all the time, but sometimes it can be quite painful. For some people, when you're urinating, so having a wee, it can sting, it gets inflamed, but it won't stop you from having children or anything like that. So most times if you do become pregnant around your 10 to 11 week mark, your uterus basically tips itself back forwards again.
What, the weight of the baby just
tips it? Yeah.
Oh, okay.
Yeah.
Quick question, was you born like that or did it just happen as you grew?
So it can be genetic, so I could have been born with it, or it could have been a cause of the underlying endometriosis. Because with endometriosis, it's the lining of your uterus which starts to grow on the outside of your uterus. So it can grow in different parts of your body, such as like your liver, your kidneys. It can grow on different bits. It's like scar tissue.
Yeah.
And obviously, because it's got the characteristics of the lining of your uterus, it starts to bleed as well when you have your period. So that causes the inflammation.
Oh my god.
So yeah,
that's
with those
all I knew
tissues,
about endometriosis, that you get really, really bad periods.
Yeah.
Because obviously it's coming from all angles, I guess.
Exactly. Yeah. Very, very painful. Not a good sight, but it could, with the endometriosis scar tissue, it can stick your uterus backwards, which could cause it to be tilted backwards.
Okay.
Yeah, so it could be underlying.
So what did you find out that you had first?
I found out that I had a cyst first, which was called a dermoid cyst. Now, normally pregnant women find out that they have this cyst, so the first thing I had to do was go into my GP, have a pregnancy test, and they kept on coming back negative. So at the age of 17, I don't have any knowledge of any sort of gynecology issues, problems. So that's when they had to, I had to go in to have an ultrasound done, and they saw a very large cyst, which was 13 centimeters when they found it. I had to have MRI scans to make sure that it was non-cancerous, which it was non-cancerous, thank God. And then continue to have MRI scans, ultrasounds, and I had a 9-month wait until I had surgery. So by that time, it had grown to 20 centimeters.
Just for the sake of the watchers, can you show us with your hands how long 20 centimeters?
So it was, I looked about 8 to 9 months pregnant by the time.
Is this why you needed pregnancy tests?
Yeah.
Was that the only symptom that made you think you were pregnant?
That's the only symptom. I didn't get any nausea, any pain. The only symptom was my stomach. I was putting on a lot of weight within my stomach area, and it was just growing and growing. And it's not bloating, because I looked about 8 to 9 months pregnant by the time.
Oh, it's just your belly?
Just my stomach.
Do you know how mad that is? Because certain cultures, obviously, like anyone anyway, but when you were 17 at the time.
17.
17?
Yeah.
To go home, for you to tell your mum, I promise I'm not pregnant.
Yeah.
But boy,
that was really hard.
Okay then, Mary.
Exactly.
Yeah.
Literally, that is like immaculate conception for people, honestly.
Yeah,
Which why Mary was such a good little line there. Love that. Fucking hell. Oh, that's horrible.
Yeah. That must have been so painful.
It was.
So at 17, was you in college? Did you have to
I
take
was
time
finishing
off?
college,
Finishing college.
just finishing, so starting university in September. So I had to wait all that time for surgery, not really knowing what the hell was going on.
Were you getting
And
bigger in that time?
Just bigger and bigger. So I didn't really want to leave my house because my family are from Jamaica, Caribbean. So, you know, when you go to family functions,
They will tell you look fat.
Exactly.
Or
They
pregnant,
will-
and
they
who's
will-
the dad?
Yeah, so
They
they
have
always
zero filter.
got very suspicious, but that's
So
what
what
was
made
going
you
on.
decide to go to the GP in the first place, you know?
So I will always look at myself in the mirror and just think, do you know what, I'm actually looking a bit bigger in the stomach area. I used to exercise quite a lot, so I was just thinking I'm not eating anything different. I went to my GP and they diagnosed me with irritable bowel syndrome, which is what they normally do diagnose you with straight off.
Because
What
if
if
you're
you got- if you
bloated.
get in a bit
Because
of
it's
a
just
belly.
bloated.
Yeah.
So I was just told, go back home, change your diet, stop eating cheese, milk, whatever, the lot. And that's what I did, and still nothing was improving. But I wasn't feeling any pain or anything. My periods were normal, so they were still regular, coming every month. It's just that my stomach was getting bigger and bigger and lopsided in a sense, because the dermoid cyst was on my left ovary. So it was growing to the left, sort of thing. So it was horrible, really horrible.
Like you
Do
said
you
as
know
well.
sometimes when you need to go toilet for a number 2, yeah.
Oh my god.
This
I
might
don't
be
know how we're getting
this might be TMI, but if I like looked at, I don't know what is your bowels on your left or your right?
It's kind of slightly to your left.
Yeah. So when your belly is when you need to go to the toilet, if you look at your belly and pay attention, you'll see that one side is bigger.
Yeah.
Okay.
So I can relate.
Yeah.
Yeah, same thing there. Bloody hell. Twins.
No, but
Okay.
as in I would have overlooked that. Is what I'm saying, because it happens to me normally anyway. So I would have just thought, oh, that's normal. Must need to go to the toilet.
Yeah.
That's very observant of you.
Yeah, I'm very in tune with my body.
Very good.
Carry on.
Yeah, so that's basically what brought my attention to go to the GP. I was very scared at first because you just think of the big C. That's the first thing. You go to Mr. Google and you start thinking of all the worst things, worst case scenarios. So I did go to my GP eventually, probably about 2 months later. And that's when they said, you know what, we've got to basically get you to have some MRI scans, ultrasounds. And then they determined that I had a cyst, but didn't know what type of cyst it was. So then the MRI scan was able to show what type of cyst it was. So it's it's disgusting. If you go on Google and you type in dermoid cyst, it grows hair. Sometimes it grows different features. It's horrific. It's horrible. So yeah,
I'm just
like this
Googling it
alien
now.
growing inside of you.
Oh.
Did they, when they took it out, did you see it?
Yeah, so I've got a picture.
Please bring that up.
I've got a picture on my phone actually.
Do you know appendicitis?
Right.
They had her appendix out.
I just Googled that. That is just not
gosh.
nice.
Yeah, that's a
I've
lot
got
of hair.
goosebumps. Oh my god.
Come on,
This
what's
looks
that?
like. What is that?
It
Why-
looks like teeth. That's the thing, because it
I'm
can grow
scared.
these characteristics.
What
Yeah.
the hell is that?
That's got a whole personality.
Yeah,
It looks like a
literally.
baby alien.
It has its own.
You must have been
blood supply.
mortified.
I literally.
Oh.
Oh god. Okay. So, what is Let's Talk Gynae?
Yeah.
So Let's Talk Gynae is a platform that I help to empower, educate, and elevate young females about their reproductive health, the importance of it. We talk about the 5 different gynecological cancers, and basically it's just an empowerment for people to carry on the conversation about reproductive health. Because I feel like me at the age of 17, not knowing anything, you know, you go to school and they give you some sort of like sex education class, but it doesn't really go into depth. That was just literally the fundamental basics of what you needed to know then, and that was it. And it didn't go any further than that. So I just want to literally go worldwide, starting off with London, where I'm from, and just carry on the conversation, carry on doing events so people can come along and you're learning. It's an interactive sort of, because I don't like just the sit down things where you just, I don't really like it. I find it really tedious, it's boring. So I like doing these sort of events where we're painting. And
It was good because
Yeah,
like
we
even
loved
as we
it.
were doing this, like, I realised I didn't even know like
Same.
how to draw it or like what's
Yeah.
there. Like I didn't know like what the hell to do. I actually had to look it up and find like a picture to go by.
yeah.
I labelled mine because I wanted to actually learn moving forward
Yeah.
what every bit was, because the thing is, when you hear like female system, I don't know about everyone else, but all I think of is vagina, because that's all we know really. That's the most common one that people talk about, but that's probably a less relevant one. If you look at everything that's part of it, like our ovaries are very important, and like your cervix is very important as well. So the vagina is just the one everyone makes a big hoo-ha about. Really.
Exactly.
There's lots of stuff.
I didn't know that the vagina was just a part of it. I thought that
The vagina was the whole thing.
the vagina was that, and then inside of the vagina
Same.
was XYZ,
Literally.
which is mad.
I know.
But from the Let's Talk Gynae event, you gave us little goodie bags,
Which were great.
and I brought this flyer, which actually has
I
the
read that
5
as well.
types of gynae cancers that there is. So there's the womb, cancer of the womb, ovarian cancer, cervical cancer, which is the most popular one that we hear about. Not popular, that's a dumb word.
Most.
What's
Commonly
common,
commonly spoken about.
Vaginal, which you wouldn't think, I've got vaginal cancer, and vulval.
What exactly is your vulva?
Yeah, because a lot of people get mixed up. They think the vagina and the vulva is the same thing.
I
but
did.
It's not actually. The vagina's inside and your vulva's on the outside. So if you get a mirror and you have a look down there,
You'll
that's
see the
your
vulva. Okay.
So your vulva is like the clitoris, your labia minora, labia majora, all
Is that the lips?
Right. So you'll be able to
use
see
English
those.
out here.
Yeah. The lips. So that's your vulva, and then the inside is your vagina.
Okay.
Wait a minute. So
No,
the
my whole mind
vulva
blown.
is not just one item.
No.
It's the vulva is
The umbrella term for
not vagina,
No.
No, a vagina's within the vulva.
which is crazy.
I know.
Yeah.
What have I been taught my whole life?
I don't even. But you're not even taught, are you?
Exactly.
No one sits down and tells you like where everything is or what it does. And that also links very, very closely, I think, to like female pleasure.
Yeah.
Like I think that's the reason that most people, well, a lot of women don't know what they like sexually or like how to make that happen, because you don't even know where anything is.
Yeah.
When I remember the first time I tried to put a tampon in, this girl who like had sex, so we were like 15, so she was like a goddess, because she could like tell everyone their problems because she'd had sex that she knew. Lol. And like, what kind of sex you having at 15 anyway? Let's be honest. Anyway, so she was doing it, and then she was telling me, because I was like, I can't put a tampon in, I don't know how to do it, whatever. She's like, right, what you need to do is you need to know where your hole is, and then you need to know where your clit is. And I was thinking, like, obviously as an adult, why would I need to know where my clit is if I'm putting in a tampon? Do you know what I mean? But this is that is my biggest education about this. And that was very remedial. So that's how none of us know anything what's going on.
Yeah.
Yeah, it's true.
That's why I say to some women that I speak to as well, is just get a mirror. Sometimes it just helps to have a look, like literally just get the knowings. Go on the internet, see what the vulva is, what the makeup of it is, and then obviously it's not going to be the same as the picture that you're going to see online, because everybody's vulva is different,
which is insane as well. Like, why don't they all just look the same?
Exactly. Some people's got bigger lips than some, and some people have really tiny ones, so it's gonna look totally different. But just have a look.
Have you guys done that before? Looked?
Yeah, I do it quite often.
I have it.
Have you actually?
Yeah.
I didn't think you would have.
Yeah. Have you?
Yeah, I do all the time.
Yeah.
Oh, so I do it as well when I feel like something's a bit off.
Yeah.
That's when I definitely do it. Like for me, I'm gonna get too much into this now, so I'm just gonna move through the agenda. Anyway, okay, so that's what Let's Talk Gynae does. So the platform, what does the platform consist of at the moment? Is it just these kind of events that you're running? Or?
So it's just the events. Because I work as a nurse full time at the moment. Well, I'm flexible working now. So I do go on to different wards as well. So I work on the urology ward, so mainly with males, so dealing with a lot of penises. But we do have a section of females, as well. We've got a section of wards with females as well, so that's where the gynaecology side comes along with it. So I do go and talk to the patients to get real life experiences, which helps me as well, knowledge wise. And I go to different seminars and stuff like that, training sessions that probably work can help me with as well. And then I put on these events as well. So that's what it is now. But I do have traveling as well that I want to incorporate, because I want to go to different countries to explore how the reproductive health is out there. Like, how is it taught out there? What do their GP things consist of, their services, what resources they have that we don't have here in London, and go to different clinics and stuff and speak to real life people who are dealing with these problems.
Yeah, I feel like that's so fascinating, because I have friends from, like, for example, my Italian friend, she says that in Italy, like, you always go to the gynaecologist, like, you always get regularly checked, just to, like, you know, just a regular thing. And same with my American friend as well. She was like, yeah, like you always go, like you always go to the gynaecologist.
They're always talking about it in films, aren't they?
And she said that she came here and she went to the doctor. She was like, hey, like, can I just see, you know, the gynecologist for a checkup? And they were like, oh, you can't be referred to one unless, like, you think
You
there's
have a
something
problem,
wrong.
yeah.
She was like, what? I'm trying to prevent something from happening here. Like, what do you mean? But I found that mad.
They're just sending you to the clinic to go and sit down and wait all day.
But when I was younger, my mum's, one of her closest friends actually passed away from cervical cancer. So since then, I've been like hyper shook about anything to do with that area. So I actually think it's very shocking that we have to wait till 25, I think it is, before we get smear tests.
Yeah.
And I'm always like, can I go sooner? Even though it's not pleasant, and I know from so many people that it's horrible, I really think smear tests are the way forward. And that was the reason that she actually was diagnosed with cancer, because she wasn't going for a smear test. And my mum didn't know. So she said, had I known, I would have made you go. Like, it's so important. But again, there's not really much education around that. So can you just go in and explain, like, what a smear test is, why we do it, and why it is until we're 25, like?
So it's a cervical screening that we go from, you get it at the age of 25 to 64. And basically you go into your GP service or to a health clinic, and they take a few cells from your cervix, so they get like a swab sort of thing, take a few cells and then send it off to the lab to check for something called HPV, which is human papillomas virus. So it's a collective amount of viruses that can cause like genital warts and stuff like that, those sort of infections, and that can lead to cancers if it's not detected early enough. The reason as to why, I think I did read up on something in terms of why we have to wait, they wait until 25, is because they feel like our cervix is not well developed until that time. So if we go in too early, we might start destroying some of the cells before that time. So it sounds a bit weird because you're thinking, well, 24 and 25 is just, you know, round the corner. Why do we really need to wait until 25? Because if we could go earlier, I definitely would. I would definitely. I'm for it. But waiting until you're 25, I think it's because it's destroying what is not really built up as yet. It's not fully developed.
So I went for my smear test in April, I think it was.
Was that your first one?
Yeah, it was my first one. But they sent me the letter in November when I was still 24.
So they do it before your birthday so that you know.
But they sent me like 3 letters like, you haven't been yet, you need to go. And I was like, I'm not even 25 yet, can you get off my back? And then I was like, I'm not going until I'm 25 out of principle because I shouldn't have to do this. And then somebody got on to me and they were like, why don't you just go? What are you waiting for? And I was like, okay, fine. So then I finally went and I was really shook. And then when I did it, it's not that bad. And it really is over in like 20 seconds. I mean, it's a bit of discomfort, but sex can be uncomfortable.
I was about to say.
Tampons can be uncomfortable. Washing can be uncomfortable. So it's like over in 20 seconds and it's good and it can save a life. So it's worth it. But then after I did it, I felt good about doing it. And then I was like, okay, I need the results now. Oh my God, the results took 8 weeks.
8 weeks?
Because there's a backlog, because so many people haven't been going, and now all of a sudden everyone's like rushing to do it because there's more awareness now. So there's a backlog. So I finally got the results, and it said I was fine, but there was some signs of irregular cells. However, it's nothing to be concerned about, so they say, and I'm alright to wait for the next 3 years for the next test. But the letter could say like, you have this, and then you would need to go back in and then take it from there, I guess.
You know, it's actually fascinating that you were talking about HPV, because I was literally talking to Maya about this in the car on the way here. I literally heard about this the other day. Because again, like, always Americans are laughing about this, talking about this. And I was like, what is this? Like, why do I keep hearing about this? And then apparently 80% of the population have HPV and they don't know, because a lot of times there can be no symptoms. And it's basically like an STD kind of thing, right? And I was like so shocked and like traumatized, like, oh my God, you can have HPV and you don't even know. And
I don't think it's not an STD. It's caused by sexual intercourse, but it's not.
Okay, yeah, I don't know.
You can't catch it.
Can't you?
No.
Oh.
So you only can have. You basically have to have sex to get HPV. Basically,
But you don't catch it through sex.
Don't you?
No, because it's like the discharge sort of from your cervix.
Okay.
That's secreted from your cervix because it comes from the cervix basically. That's on the surface where the HPV will develop. but through sex, it obviously can interfere with some of the cells of your cervix.
Because
which
that's the
then-
only thing you do, which brings everything
Yeah.
out and in, up and down, up and down.
I see. And apparently, like, men like won't really get cancer from it, but there are lots of ones that will be spreading it, and then the women will be the ones at risk of getting cancer.
Ugh.
I was like, what?
So how do you get it then? Is it just random?
It's just through, and I think the age for the smear test as well is 25 to 64 because they believe that's when you're most sexually active.
Which is ridiculous.
So that's like, so you literally just get it through like from the friction, I'm guessing,
That's
and
so
like the
bad.
bacteria that goes in and out.
Because if that's the case, then why is the legal age to have sex 16? Not that anyone goes by any of these things,
Yeah.
but like if they're trying to do this for that reason, I feel like it's another way to try and control women. Like, you should be good till you're 25. You know what I mean? Then you're allowed.
Exactly.
It's like if you're telling me I can till 16, which is probably for the men's benefit anyway.
Yeah.
It's just ridiculous. So
Mhm.
get on it.
Yeah, for sure.
Did you guys have the injection in school?
Yeah.
Yeah.
Did you?
Yeah, I did. Yeah.
I didn't.
Did you not?
No, I didn't.
A
How
lot
many
of
do you have to
people
have?
haven't,
Yeah.
though.
Yeah, I know. I know a lot of people
But
have
they
it.
did come, and I was like,
Did you say you didn't want it?
I wasn't allowed. Well, not that I wasn't allowed, because I could have just did it if I wanted to. But my mum was like, she's really against like
Foreign bodies and
on unnecessary injections.
That's good.
So, like flu jab, we wasn't just never about it. So now in my adult age, I'm like, flu jab, no thanks.
Good.
But me, because I have sickle cell, there's some jabs that I do have to have, like protection against pneumonia, things like that. But anything that's like flu jab, like how can you make the jab before you even know what the strain of flu is? It's just weird to me. So things like that. And then like with the cervical cancer, like how do you know that they're not? Because with a lot of these protections, they're injecting it into you for your body to then fight against. What if I don't fight against it? What if it gives it to me?
Yeah.
So with things like that, I just always don't usually get. So I never had it. No.
And the side effects a lot of the time can have effects on like a woman's reproductive.
Yeah, that's what I started to feel like in terms of me, because when I had it, it was in year 8 when they came. So I thought they were using us first as the guinea pigs.
Yeah.
In
we
terms
was
of
quite young.
trying to, because they started when we was 12 to 13, and there was 3 jabs at the time that you had to get in the course of like 1 year or something like that. So I only received 2, because then by that time my mum was just getting a bit suspicious, thinking, do you know what, why do you actually need 3 of these jabs?
Is that a Jamaican thing? Because
Yeah, I don't know.
we're just like everything's a conspiracy.
Yeah,
literally everything. So I didn't get the 3rd jab. But then as time went and I'm going through all of these problems, I started thinking to myself, is it this HPV vaccination that probably could have, made these cysts come about?
And you would never know now.
I just never know.
But you only had 2 of them.
Only 2.
So maybe if you just have 2, there's like something goes wrong.
But now they're only given 2 to the it's not 3 anymore. It's only 2. Yeah, so I don't know.
That is very, very weird.
Yeah, they're giving it to boys as well.
Oh, really?
Yeah, so they're gonna. I don't know if it was from last year, or if it's from this year, but boys will be getting the vaccination as well. Yeah.
Or offered it.
Yeah, offered it.
So what happens if you only get one? It's just not effective if you only get one injection.
It's probably not as effective.
Yeah.
But you still like a little bit.
Yeah, you still.
I don't know.
I don't think it works like that, Jade. It's not like have a little bit of it. I think that the 3 needs to work. You have to have 3 for it to be at all protective.
That's like getting a 7-day antibiotics, and she's like, I'm just gonna take Mondays.
Yeah.
I did do that with malaria tablets once,
Oh my god.
and I just YOLO'd it.
Oh,
Shall we go through our pictures?
Yeah.
Okay, I guess I'm going first.
Yeah.
Right, so here again, if you haven't subscribed, this is to you. I have a picture of the female reproductive system. Is that right?
Yeah, that's right.
So I googled this to tell me, and I actually had to ask you during because they spelled everything wrong. Again, shocking. Women life is terrible. So I've actually done the whole thing, and I don't know where anything is, so I can't hold it up the whole time. But there you go. I'll take a picture of it and put it on the Insta for you. So I've got the uterus on both sides. Uteruses. No, ovaries. Ovaries. My bad.
You've labelled
Ovaries.
it.
I know, because I'm trying to do it offhand. Right, the ovaries on both sides. I've made one slightly bigger on purpose to show that like that can happen, and it's all right. I've obviously got
I see what you did there. Okay.
I've got the connector bit on there. I've made it very. What's it called? The
Right,
connector
it's
bit.
labelled,
The
right.
Fibria, but it's a part of the fallopian tube.
Okay,
yeah.
part of the fallopian tube. This is the fallopian tube. The tube's going around. And the ovaries, yep, I told you about that as well. The cervix is just there, above the vagina.
Yeah.
Yeah. And then I made the vagina like a flower, like a very vibrant plant, to show that like life and like,
Yeah.
you know, to change the whole thing, because it's very stigmatized all the time.
Yeah.
Like obviously as women we're treated badly just because you have a vagina basically. And I wanted to change that whole thing. And then the myometrium,
Yeah.
what did that do?
So that's basically just a part of your vagina. It's like the walls of the muscular.
Okay.
walls of the vagina.
Is that where your smear's taken from?
No, so your smear's taken from the cervix.
That's it, you said that. Okay, right, fine.
Oh, that's high up.
Yeah.
And then the perimetrium is the outer bit of that. The cervical canal,
Yeah.
there you go. All of that's just like carries all your stuff.
Yeah, so that just carries up.
It's a canal, so
Yeah.
it's like, yeah, things flow through there. And that's pretty much it. I've just added lots of colour because it just needs to be changed into like a colourful thing.
Yeah.
And obviously we've got the uterus right there, the big guy.
So where's the womb in all of this?
So the
at
uterus
top.
is the womb.
Oh,
It's just
Yeah.
called uterus.
Yeah.
Okay.
It's
The
just a
uterus is the
scientific
womb.
word.
Mm.
Yeah.
oh,
Yeah.
Yeah.
They use it interchangeably.
Just like labia is actually lips.
okay. So that's why when you have a baby, it pushes forwards and pokes your belly out.
Yeah.
Okay,
cool.
Right, well mine obviously, clearly I'm not as artistically, you know,
I
inclined as
think
you
Jade
guys.
does it.
I'm not sure there's much like, you know, different
Higher.
interpretation here. But yeah, so mine, I just did it like obviously pink is like feminine and obviously like, I don't know, I just thought it would be a nice colour. Obviously this is a female issue. So yeah, I did the female reproductive system. So you kind of got everything that Maya said there as well. And yeah, I mean, that was it. I found it really interesting to paint because I didn't really know what it looked like, or I wouldn't even know where to begin on how to draw it. So I had to look up a picture, and it really was actually useful for me to like figure out all these parts and what they are and like what's actually going on. But I was confused about what these bits are. Like, you know, that one thing that goes from the ovaries back up to the, you know, that little.
Oh, these things.
Yeah.
So basically, it's just a connector back to the uterus, but it's
Okay.
not, because this is within our pelvic cavity. It's quite an open cavity. So some people think that our fallopian tubes are attaching onto our ovaries, which they're not. So that's why with ectopic pregnancies, if the egg flows through the fallopian tube, sometimes it can fall on the outside of the fallopian tube, and then the baby can just grow within that space, and then obviously it can't grow anymore. So yeah, it's an open
Okay.
cavity. Yeah.
Okay. And yeah, I really enjoyed painting it, and yeah.
I think the sip and paint is such a nice idea because it's about the relationship we have with
Yeah,
that area as well.
it's very personal, but also something that you share with others while you're there.
Yeah.
And you can also change it because if you draw something pretty, even though you might not feel pretty down there, or like you
Yeah.
feel, then that can make you think, oh, actually, you know, it can be whatever I want it to be. Or,
Exactly.
you know,
Yeah.
got your whole ideas there.
This is mine. Obviously, if you're listening on audio, you can't see, so follow us on YouTube. Just type in Tried It Podcast. I, again, didn't have a clue. I knew it looked like a trophy, but
Oh, yeah.
Oh,
I like
that
I
is
didn't,
brilliant.
I didn't really know the rest, so I googled a picture and it was really pretty. It had like flowers growing out of it and around it, and some leaves and stuff. So I attempted to copy that, and this was the final product. So again, it's very colourful, very bright. I got carried away. I've not been painting before. I was just having fun with it.
Aw.
What are these called again?
So it's all ovaries.
So my ovaries, I made flowers.
Aw.
And obviously a code word for the downstairs area, sometimes called a flower. So
Yeah.
I tried to be cool with it. Yeah, that's about it really.
Oh, I really like
I
that.
showed
It's
it
really
to my neighbour
colourful.
and she said it looks like a plant pot.
Oh, yeah, it does.
Do you think?
Yeah.
I mean, it's not something I'm going to put up in my hallway, but I am proud of it.
Yeah.
I don't know why you don't put it up in your hallway.
So
And yours?
for my one, so this is not my original one that I painted.
Although yours
Which yours
was
was-
lovely.
yeah, it was really
Thank
good.
you. But I got my friend who's an artist, Latifa, to paint me this picture for my launch of Let's Talk Gynae. It was in January 2018. So I sent her like a visual of what I wanted. and I wanted to create something that, like you said, you did flowers, because I wanted it to just people to look at it and be like, oh, our uterus is just beautiful. Everything about the reproductive system is magical,
It
literally.
really is.
So
it
I
even
wanted-
looks quite nice.
Yeah.
Like, even like just as a trophy, like you said.
Exactly,
It's
yeah.
quite nice.
So we've got the ovaries here, so the 2 ovaries, one on the left, one on the right. And then we've got our fallopian tubes, which is just representing flowers again, so beautiful. We've got the womb, the uterus, and then you've got the neck of the womb, which is the cervix, and then you've got the vagina bits down here.
Question: when you put a tampon in, how far does it go?
Ooh.
So it won't go as far as to your cervix, even though you can actually use your finger if you wanted to, because some people do, just to feel what their cervix feels like, and it feels like the tip of your nose.
I do, yeah.
Are you joking?
No.
Okay. Thank you.
You never done that before?
No.
When I say
even
all
think
the
of
time,
myself,
I don't mean like daily, but regularly enough. Yeah,
Mhm.
I do
What do you do?
feel it.
Her cervix.
You're like in the walls.
Oh yeah.
I touched like the outer bit, but not. I hardly ever. But I'm scared to do that because I don't even think of myself, so I need to work on doing
okay,
that.
yeah.
Okay.
Yeah, I think women that like self pleasure kind of, I guess you get to know like what.
Yeah,
what it's all
exactly.
about.
Mm.
Yeah.
Yes.
That wasn't what I was talking about, by the way. I just feel it for feeling
For
it.
For good
educational
measure.
purposes
For
only.
good measure. Everything there. All right.
But yeah, that's.
So it won't go as far as that. Go up to like one of
So
them.
yeah, it goes
Yeah,
up to
we'll
like.
go,
Oh,
yeah.
okay.
But not as far as your cervix.
Okay.
So you can't lose a tampon.
No,
Okay.
you shouldn't be able to. No.
Myth debunk.
Cool.
Wow. Okay. Cool. Do you have anything interesting, whilst you've got that up, about your area, your whole reproductive system, that we may not know, that are like fun facts?
Yeah.
So, does anybody know what vaginitis is?
No.
Is it cystitis?
Sort of, in a sense.
I've had cystitis. It's
Had
bloody
cystitis.
horrible. I hated that
I
shit.
all the time,
Sounds
but-
painful.
Oh my god, I wasn't having sex or anything. I got it when I was like 12 because I was quite big.
Oh.
Yeah,
So you were drinking
and
water and stuff
it was
as well.
because I was wearing really tight jeans, and that rubbing must have like affected me. And then the first time I ever had sex, I had it not because like it was an infection or anything, but just because like I was.
Is it on the outside or the inside?
Inside. I
Oh.
must have not been too wet, and then like that rubbing friction
Yeah.
was just.
And you should like pee after, innit? So like make sure you don't get it.
Yeah, you're supposed to drink loads of water and cranberry juice and antioxidants and that kind of stuff.
Yeah.
But these times I had to go to the doctor and get medication.
Yeah.
That was not helping me. Honestly.
But yeah, so vaginitis is basically inflammation of your vagina. This whole area down here will be very inflamed, very red, very sore. When you try and go to have a wee, it stings, it burns,
Yeah.
and there's also discharge, which is very smelly, has an odor and colour to it as well. So vaginitis is basically caused by STIs like chlamydia. It's also caused by bacterial vaginosis, so BV, and various other types of infections. Also, we're going to talk about female cleanliness as
I
well.
was just
so
about. It was such a good segue.
get
You're
into
natural.
that, because you don't want vaginitis, because it's a horrible thing to have.
Mm.
Thrush is also a part of
When
the
you say
cause.
caused by, so that means that you get chlamydia,
And
get
then-
rid of that, and then you're hit with this.
So it's basically vaginitis. So thrush, for instance, is causes vaginitis. So it causes the symptoms of it. So like the itching, the inflammation, the burning sensations. Yeah. So vaginitis is more of the symptoms of
Okay.
those infections. So that's something to think about as well.
Mm.
Where
Yeah.
does the
Try and stop
the
me.
urethra fit into all of this?
So the urethra is not part of
Mm.
It's
none
not.
of this, no, because you've got a urethral opening,
But it
which
comes
can
out at
see.
the front, yeah.
yeah, you can see it if you get a mirror,
Seeing
so
it.
you can see.
I have
yeah,
seen that,
so
yeah,
you can
yeah,
see
yeah.
the opening
Mm.
of your
I used to
urethra.
think that we could just wee out of that, which I know we do.
Mhm.
Is that the only place we comes out of?
Yeah.
Is it?
Yeah.
What?
Yeah.
Alright.
What did you say?
I said, I said I know that you can wee out of that urethra.
No, it's not that you can read. That is where
Yeah,
your wee
yeah,
comes
yeah,
from.
I know. But then why can't we just wee like boys? I know it's a lot smaller, but do you know what I mean? Like I know, like when I'm squatting over the toilet,
Mm.
like when I'm somewhere public, and and it's just a straight line, like it would be like it was a willy, but it's not, and it's actually a urethra.
Oh, I get what you.
Yeah.
You don't get it.
Yeah.
What?
So, but then I thought the reason it all comes because it doesn't come out straight all the
Because
time
we
when
have a
we
shorter
read it.
one, isn't it?
It's 5 centimeters, and
that's cute.
male's one is 20 centimeters. So that's the reason why we get UTIs quite quickly.
Because it's faster in.
Yeah.
Okay.
And we've got a shorter urethral tract as well. So
How handy though. I've always wanted to have that ability.
You should get a
to be
Swaby.
anyway. I know, I've thought about that, but I
A
can't.
Swaby, what's that?
You put it in, and
It looks
it's
like a
you
funnel.
Can, yeah, and then you can
Put it
like
over your vagina.
marathon runners and stuff have it a lot.
okay.
Okay,
Yeah.
alright. Let me know how it
Not
goes.
that I have
And
one.
if you are a Shiwi company and you want to send us a few or sponsor us, we're the place.
So that's what vaginitis is. So that's
Okay.
just something to think of. Vaginal atrophy.
What's that?
Oh, I don't
Oh.
know.
Sounds like trophy though.
Yeah.
It sounds like a nice thing to have.
Yeah.
No, it's
Oh.
the complete opposite.
Oh god.
So that's basically the scientific word for vaginal dryness.
Oh,
Okay.
no.
Very dry vagina.
Yeah.
That's a serious thing.
That is a
Yeah.
serious
A
thing.
lot of young people actually suffer from it and
Yeah.
they don't talk about
Yeah,
it.
Yes.
yeah.
So how do you know if it's a real, like you have it or you're just dry?
You're just really dry down there. You know that you have it because sometimes after you have your period,
Mm.
you do have that sort of symptoms of having like a dry vagina. It's a bit dry and then it starts to become moisture. It starts to become a lot more lubricant.
Mm.
But for some young people, they just think, oh, when I get to menopause, then that's when I'll have this problem. But we do actually suffer from it.
I
There's
didn't
a lot
even
of
know that it
people-
hit
yeah.
when menopause came.
Yeah, they get a lot of vagina. So they use like a lot of vegan products like lubricants to just loosen it, or they go to their GP where they can take medication for it to help it, you know.
And doesn't like having the
goodness.
pill and stuff affect that
It
as
does
well?
as
Yeah,
well,
yeah,
and
yeah.
especially for people who breastfeed, it can give you vaginal
Yeah,
dryness.
a lot of my
as well,
clients
yeah.
have had that.
Really?
Mm.
How do you know this?
They told me, we've become very good friends. And obviously we were training about...
Mid squat, yes, and my vagina's really dry. This
No.
Someone walks past and you hear the
So
conversation like, what is
That
going
has
on
happened before, but no. It's just because obviously, like, when you're speaking about something pretty intimate, because, like, they're having to tell you,
Mhm.
oh, the reason that I can't do this is because when I had my baby, it ripped my this, and then I have to, and that's been sewn up, so I can't actually this, and I've got really bad hemorrhoids now, or whatever.
Yeah.
And then it just becomes normalised, and they'll be like, oh, and also, do you know what I mean?
Mm-hmm.
Yeah.
So that's vaginal atrophy.
So what causes that? Is that just something you can just have?
You can have it. It's all to do with our hormones.
Mm.
Oh,
Like
okay,
in hormone imbalance, basically. Sometimes our hormones go erratically everywhere, and then that can cause you to have a very dry vagina. And then sometimes it doesn't happen. So you're not born with it or anything like that. It can just develop and then go away, and then
Mhm.
sometimes it can come back again.
Mm.
So yeah, it doesn't carry on. But for
Okay,
people
yeah.
in menopause, then it would normally
Mm.
cause them quite a lot of pain and discomfort.
That's
Okay.
very nice.
Yeah.
Yeah, so that's vaginal atrophy. So having cyst on your ovaries, because I get a lot of questions, people send me like DMs about cyst on the ovaries, not polycystic ovaries, because we can get into that as well. But with my cyst that I had, so I had a dermoid cyst on my left ovary and I had an endometrioma cyst that was on my right ovary. So that was the second surgery that I had to have to get that removed because it didn't go away on its own, which some doctors will tell you, oh, the cyst will just go away in a couple of months, which I was told plenty of times and it didn't. It just kept on continuing to grow and grow until it could rupture, which in my case it didn't, because if it does rupture and burst inside of you, it can cause
What's
a
that
whole
poisoning,
lot.
no? Sepsis.
Basically, yeah.
God.
So it can cause a whole load of other health issues for you. And if you do have a ovarian cyst that continues to grow, sometimes they do the watch and wait sort of thing to see whether it will continue to grow and then probably put you on the waiting list to have it surgically removed. But in that period of time, just be careful with that because it can twist, your ovaries can twist on itself with the cyst and it can cause ovarian torsion, which that's emergency surgery. Your ovaries will need to be removed if that does happen. So it's just to be aware, because a lot of people think, oh, well, I've got a cyst on my ovary, I've been told, and it's still there. But just be careful, because it could still be growing.
Yeah.
And, you know, you don't really get any symptoms of it. That's the thing. So I didn't have any. And that's what happened to me. It continued to grow. So, yeah.
So do you still have both of your ovaries?
So I've still got both of them. The first surgery that I had, they did tell me, oh, we might have to remove your left ovary because it was so big at that point that there wasn't really much to it, they thought, but when they went in, they saw that it was still intact and they just left it there. So I was just told afterwards, oh, you've still got both of your ovaries.
Oh,
So
good. Okay.
But you can still have a kid with just one and stuff,
just
can't you?
with one
Yeah,
ovary, yeah.
Quick question. Fibroids.
Fibroids can grow anywhere within this region really. I haven't done a lot of research on fibroids, but going into that speciality.
Okay.
But it can grow anywhere within your reproductive system.
And fibroids are?
Those are like kind of like muscular looking balls sort of thing, which they do cause pain and discomfort for some women. They can grow bigger, there can be multiple of them, but some women just have one huge one. Some have multiple fibroids everywhere, which corrodes this whole area, and it can stop people from having their periods or make them irregular, and it can just stay there. Because my mum has fibroids, and she went to her GP quite some years back when she had me, because I'm the last baby, they call me. So when she had me, they discovered that she had fibroids, but they said they would never cut her to do surgery, because that would basically be it for her. Because where they are positioned, they could cut through her bladder, they could cut through anything here, and then that will be a whole lot of blood loss.
Yeah.
So yeah, so for some women, they just leave it there, or they can be lasered off.
Okay, yeah, I have heard
They
that
can
actually.
be lasered.
So this is a big one now. Vagina and smell.
Yeah.
Like, let's talk a bit about that, because that is the bane. Like, we laugh, but that is what a lot of girls and men have a conversation about, I'd say probably daily. So where do you stand on that? What exactly, like, let's debunk some myths, because people always think, like, I've been doing some reading as well, because I would like to get to a point where I don't have to have any contraception, but also not get pregnant, so it's the impossible. But I know that you can do things like really be very strict about controlling the conditions hormonally, so you can not eat certain trigger foods, and you can just loads of stuff. You've got to be hella strict about it, which I'm not in a position to do right now, hence why I still have contraception. But what I did read was that your flora or your fauna, like internal, like what is that exactly?
It's basically, because I had to write this down because I'm not really good with pronunciations, but it's called lactobacillus.
Okay.
Lactobacillus, I think. I'm not saying it correctly, but that basically is the healthy bacteria that we need.
Right.
So even I'm seeing on Instagram, it's quite big in America with steam in your vagina.
Yeah.
I would never even recommend it to do it. I wanted to do it at one time.
Yeah,
because I was
I've heard
thinking
about
like,
that before.
yeah, I was quite intrigued. Like I really wanted to try it.
Stones.
Yeah,
And loads of
all
stuff.
these herbs and situations. Like I really wanted to try it, but then I did speak to a specialist about it, and they would never recommend it because you're getting rid of all of that good flora that we need, as well as the bad flora as well that we don't need. But getting rid of too much of the good flora, which is going to cause you to have an infection anyway. So with douching as well.
What is douching? When you put water up there or something, was it?
You get like a rag or something, and you're literally poking it up there and trying to clean your vagina
I would never
out.
do that.
Is that what douching is?
Basically, yeah, because I didn't really know
What did you
what
think it was?
I thought it was like basically like you squat over a cup and suck some water up there and squat it back out.
I think it's got so
you
many
can
different
do
meanings
that.
to that. Yeah, there's so many different meanings.
Not that I do. Not that I do, but I guess.
I have done it.
Oh.
I do it in the bath sometimes.
Okay.
But for some women,
I'm just disclosing way too
I
much
know,
in this
and
episode.
you know what's nice about it? With a straight face every
Yeah.
time.
Because
I do.
I'm so
Yeah, all the time.
serious.
Yeah, touch it every day.
It's good. It's good for you. Okay, I think it's good for me.
Right, well, you can tell
that's
us.
what I was gonna say. With some women, it's good for them. It's the same as using some feminine washes as well. Like you said, they're marketed very well, but they're doing you a lot of harm.
That's exactly what I mean.
I don't use it.
Like, what's it?
Femfresh.
That's
What do
it.
you mean? Femfresh, the soap? Yeah. What's wrong with it?
I know, like
What
on
we've
the
just been
packaging,
saying.
Oh, as in
it
you
will
mean like you
say.
shouldn't use any at all? You shouldn't use any soap at all?
The thing is, because like I said, it
Not
works
up
for
there,
some
you shouldn't
people.
No,
anyway.
but like
On
just
and
use
around.
Around.
Yeah, but Femfresh is good for like around, no? Obviously,
Yeah.
who
On and around,
people
it's
wash
probably alright.
inside.
People
Yeah,
put that
yeah.
in.
Inside.
Yeah.
Damn, right.
Yeah, that's what I mean by douching. So they'll put some
Okay.
soap on their rag.
Oh,
Scented
damn.
soaps as well. Just forget about it. Just
Yeah.
Hell no.
don't.
But
do
you
it.
know though, when you, especially like when you're younger, you first start having sex and stuff, you
Yeah.
get so paranoid and
Yeah.
scared. You'll be spraying your vagina with perfume and that kind of madness.
And they've got things like that as well, because I went in Superdrug the other day and I saw something, I don't know if it's from a company called Woo Woo. They've got different, so they've got like shaving gels, They've got perfume sprays, the wipes and things like that. So you can use it in and around, but not in.
Just spray it on your groin.
Exactly.
That's the bit that smells anyway.
Just spray it in that area, not inside. Just
and I
just
also,
leave it alone.
I like I say in most episodes, but I do feel like a lot of the problem, like smell sometimes, is about what you eat.
Yeah.
If you eat wildly, in terms of like a lot of processed sugar and a lot of processed food, it's gonna smell that because it's like waste product, isn't it? Like a waste thing. But if you eat clean,
I heard if you eat a lot of onions, it will taste like onions.
Really?
Is it true what they say about pineapples?
I knew that was coming.
Oh gosh, I still
Ask it for a friend.
believe in terms of with the pineapple situation, but I think it is a myth. It's not.
No, but
Really?
a lot of the, I don't even know.
So I can tell my friend. Obviously.
Yeah. So do you have any like lasting advice that you'd want to? I know like we've just done a hella for this whole episode. It's been like gems. But if there's anything else that like you have off the top of your head that you just want to give as a bit of advice?
One thing I wanted to talk about lastly as well was something called hypothalamic amenorrhea.
Please talk about that because we've got no clue.
So this is basically when we're really, as a woman, we get stressed out. We've stressed our body out to the bolt. Literally, we've over-exercised. You're doing extreme diets. Most athletes get this condition.
Oh, it's when you don't get periods.
Yeah, when you don't get any periods. And basically, it's all about Mother Nature because I was reading this book called Gynae. I don't know if you don't have. It's a really good book. It touches on every single thing. I've brought it just in case as well. But so basically, we run our bodies down, and it means that we won't have any periods. So our brain shuts down the production of like estrogen and progesterone, and basically tells it to stop sending it to the ovaries. So our ovaries won't be able to produce any. It won't send out an egg then to put into your uterus. So it just shuts down that whole production, and then you won't have any periods. So it's just being careful about, in terms of what you eat. Obviously, think about the things that you're eating because it, you are what you eat, But just don't do these extreme diets. Like try and be careful with that, and over exercising as well. Just do the amount that you can handle. Basically, don't over exercise yourself. Obviously, we get stressed each and every day with our lifestyles and stuff like that, so that's inevitable. But it's just making sure that we're doing like a lot more self-care for ourselves as well. I'm big on self-care, like when it comes to everything reproductive. Anything that I'm putting into my system, I know that it's all for my reproductive health sort of thing, helping me to stop my endometriosis bloating, because I get a lot of endometriosis bloating as well, which is serious, especially when you're on your periods as well. So it's just knowing different vitamins that you can take as well, knowing what you eat as well. I'm lactose intolerant now, so I have to pick and choose what I eat, because then it exacerbates my symptoms of endometriosis. My polycystic ovaries doesn't really give me any issues. It only allows me to it makes me put on more weight than normal, and hairism as well. So you just grow hair on your chin and everything like that. So it's just looking out for these sort of symptoms of these different sort of gynecology problems and talking about it. Don't keep anything in, because once you do that, you're putting yourself in a dark place like I did at one time. Wasn't going to go to my GP to talk about it. Didn't want to talk to my parents about it or my friends. So if you notice that there's a change, like I said, get in a mirror, just having a look down there and see if there's any changes, because once you get to know down there, obviously you will know if there's any changes in smells or what feels different, if there's any lumps or bumps. Just making sure that you're being more in tune with yourself, sort of thing. So don't hide away or be ashamed about your lady bits. Like, it's precious.
Trust me.
Yeah.
And I can actually smell if I'm coming on my period. You guys?
No.
How did we get here?
I'm just saying. Because you just said about it smells and that. Can you?
Yeah.
There you go. I'm not on my own. Shout outs. I think it's that time.
My shout out this week is Big Sean, single again.
Ariana Grande.
What?
You're saying he's single, or he's got a song called Single?
The song.
Is
Big
it still
Sean
going out
has
with
a
Ariana
song.
Grande?
That's 2 years ago. Big Sean has a song called Single Again, and it's a vibe.
What happened with him?
Oh my god, Jade.
Right, my one, I just want to shout out FemFresh. It's meant to be like, hey, I use it all the time and I feel like it's really changed things for me. It's been like a game changer. It's meant to be like a pH balance, like basically body wash just for down there. And I think, yeah, it's much better than all these normal soaps that are a lot more harsh and different, like can be like really bad. Yeah, so I would definitely shout out FemFresh. It's a game changer.
Okay, cool.
Boss Your Body events, which I did my retreat for a couple of weeks ago. And I'd like to shout out specifically because for this episode I had somebody who, obviously the retreat was food and fitness. I was in fitness, Jasper was doing the food. And somebody came on who was suffering with polycystic ovaries. They came on the retreat. And after our retreat, for the first time in a while, they got their period. So they were really, really happy because they're also trying for a baby.
Oh.
So that was lovely. And I just think
that's because of what she was eating.
and the fitness, like she hadn't moved for a while. She lost a lot of confidence, I think. Like she's just like given up and she's like, I'm not doing what, etc., etc. So I think it just, like you were saying, just to reiterate it, like we really, really don't take into account how deep things that we do for ourselves are actually affecting us.
Yeah.
And that, like going on our retreat or coming to one of our events or something is a step towards doing that. And like everyone since our retreat has all been like eating a bit healthier, making an effort, like keep sending us snaps and stuff, and it's just really nice to see. So I'd like to shout out Boss Your Body events, and we are doing a picnic at the end of this month, and details are on the Insta.
That's good.
Do you have a shout out?
Ready, already ready.
I have got the Gynaecology book. It's by Dr. Anita. This book is absolutely amazing. This is your go-to book if you want to have no nonsense down there. It's a very informative book, very funny. It's got like some funny bits, some pieces in there, but it's all the questions that you wouldn't want to ask your doctor, that you always think to ask. Everything's in here.
Wow.
So shout out for this book. I would definitely recommend it.
Thank you so much.
Thank you.
Yes,
Thank
I've
you for
learned
having
honestly
me.
so much. It's really actually amazing. to
And we're
hear.
so happy that you listened as well before.
No,
Yeah.
definitely. I
And-
love you girls.
Oh, don't save it for off because we want to hear it. I'm so happy, and now next week when you listen, you'll hear your own voice. How about
Yes.
that?
Crazy.
It's a
Yeah.
good thing.
And your paint and sips, have you got more planned or?
Yes.
Well, I've got events coming, but I'm not gonna share it as yet.
You're not
'cause,
talk too much.
not gonna talk too much, but it's all on my Instagram at Let's Talk Gynae. Everything's on there, so if you would like to come to an event, then definitely check out the Instagram page.
And we highly recommend that you do.
Yes, it was great, honestly.
Okay, well, thank you guys for listening. Like always, please subscribe, like, comment on the YouTube, subscribe on the audio, follow us on our Instagram to see what we're up to and what we've been doing and stuff. And yeah,
Leave
just
feedback.
give us feedback.
Yeah, and emails and
Yeah.
comments.
And let us know what you learned about your vagina today. And if you're a guy listening, thank you. Like,
Yes.
Thank you for
Yeah,
trying to
actually.
make yourself better and be better informed.
Yeah, 100%.
Yeah.
And we hope you enjoyed today's episode, guys.
Yeah. Have a lovely week and weekend, and we'll see you next time.
Bye, guys.
Bye.
Bye.